Welcome to today's episode of Her Health Hour. I'm your host, Hikmat Shawley, and today we're diving into a topic that affects millions, but it is often misunderstood and underdiagnosed: Polycystic Ovary Syndrome, commonly known as PCOS. Did you know that PCOS affects 1 in 10 women of reproductive age? And did you also know that PCOS can start affecting girls from as early as 11 and 12? For many, symptoms start early, sometimes even during puberty, yet it often takes years and multiple doctors to get a diagnosis. PCOS is a whole body condition with wide-reaching effects, and today we're breaking down what it really is, why it's so often overlooked, and what those living with it need to know.
Yeah, thank you for that intro, Ikma. I think it's a very important topic that we are discussing today. As Ikma mentioned earlier, we are here to understand PCOS, explore its causes and symptoms, and also discuss effective management strategies. And I'm very excited about this episode, not only because we are discussing this very important topic, but also because we have our first guest on the podcast, and also because we have a guest with large breadth of experience when it comes to women's health. With us today in the studio is Buki Fetuga. Buki, you're welcome to our Health Hour.
Thank you so much, and thanks for that great introduction.
Okay, fantastic. So, guys, Buki has over 10 years of experience as a fertility nurse in the UK. She has dedicated her career in supporting women's health. She has worked with renowned organizations like the NHS, Care Fertility, and currently she works with Lister Hospital in London. So you see why we are very thrilled to have her on our podcast today as our very first guest on our Health Hour. And as I mentioned, we'll be diving into the topic that affects so many women, PCOS. So Buki, could you tell us more about PCOS? What is this condition about? What are the symptoms? I know the obvious one is usually irregular periods, but what more should we be looking out for when it comes to PCOS, and how is PCOS diagnosed generally?
Yeah, sure. So polycystic ovary syndrome is defined as a hormonal imbalance. And I think that's the biggest thing to remember, is that, there's such an interplay of hormones within the female body. And once one or two are out of balance, that then can potentially lead to a condition. And as previously mentioned, so many women suffer with PCOS and suffer in silence. 1 in 10 women in the UK. And actually, when you look around and if you're ever in a gathering or a crowd and see that 1 in 10 is actually quite a good handful of women that actually potentially may have that condition. Now, the actual cause of PCOS is unknown. But what we do know that sometimes it can be genetic, and that it's not specific to any particular race or ethnicity. So all races and ethnicities are at risk of PCOS. And it can start as early as from beginning of puberty right up into the reproductive years. And it's good to mention as well that actually PCOS can also be linked to other health conditions like diabetes, high blood pressure, depression, anxiety, and obesity. And again, that's because of the intricate interplay of the hormones and how out of balance they are. And so many people go through or who have PCOS often go with it not being diagnosed. And the reason for that is because it can be hard to diagnose. So, you go through, if you start off really young, some women feel like irregular periods are normal, which they are not. Some women think, okay, do you know what, fluctuations in my weight is normal, which it can be, but sometimes it is not. And to really diagnose PCOS, you would need to have 2 out of the 3 classical symptoms, or at least in the UK, under the NHS. So the first one is irregular periods, and that is where you do not ovulate every month. The second one is an excess of a hormone called testosterone. So higher than normal levels of the hormone testosterone can present sometimes with sometimes having like facial hair under your chin, on your lips, around your face. That is sometimes higher testosterone, and you would see that in a blood test. And then a second one is also via scan. So having an abdominal scan or a transvaginal scan, and you would see that there are loads of follicles on your ovaries. So essentially, polycystic ovary syndromes, if you break down what polycystic ovary is, by definition, a cyst is like imagine it's a circle filled with fluid. And on your ovaries, when they were scanning you, you would see loads of small circles filled with fluid, hence the polycystic appearance of the ovary, and hence the definition. So when you're being diagnosed for polycystic ovary syndrome, you often need to have at least two of those things: irregular periods, high levels of testosterone, or a scan that shows many follicles. If you have one out of the three, you will not get the diagnosis of polycystic ovary syndrome. If you have two out of the three, likely you would get that diagnosis. And then if you have all three, then yes, polycystic ovary syndrome. So there isn't just one test, it's multiple tests alongside discussion of symptoms with your healthcare provider that will give an indication that you might potentially be suffering from polycystic ovary syndrome. And I've previously touched on some of the symptoms are weight gain. I think that one of the biggest symptoms, or a typical classical presentation of a woman who has polycystic ovary syndrome, is obesity, with excessive acne, hair under chin, on chest, on face, irregular periods, so not ovulating every month, and acne or oily skin. So, for example, if I was to come across someone who looked like that, PCOS would ding in my brain a little bit, and I would prompt investigations such as blood tests and scans of the ovaries and discussion about menstrual cycle and period health.
Okay, thank you very much for that lovely background explanation and educative talk on PCOS. Okay. So now I would like to ask a question. And a lot of people talk about when they hear PCOS, it automatically translates to them as infertility. So from your experience, what would you say like the impact of PCOS is on women's fertility generally?
I can totally understand that question and where those thoughts come from. I think when we talk about fertility itself, it's being able to have sexual intercourse and getting pregnant when you decide that that's when you want to have a baby. So to a degree, you would need some help if you are diagnosed with PCOS. It does not mean that you are infertile. So it does not mean that you cannot have children. That is not the case. So as previously mentioned, the definition of PCOS is a hormone imbalance. So therefore, in order to help with getting pregnant, we need to balance your hormones. And once we balance your hormones, you therefore will have regular periods, therefore be able to ovulate, and then therefore be able to conceive. So would it be as simple as just being able to have sexual intercourse during your ovulation period? No. Would you likely need to have a conversation with a healthcare professional who specializes in infertility? Yes. You may or may not need to have to take hormones in the form of medications in order to get you to start ovulating. But then potentially you could then just go on, once you've started ovulating every month and your hormones are balanced, having sexual intercourse at home and getting pregnant. So to answer the question, no, you are not infertile.
Thank you very much for that answer. At least our audience can see that being diagnosed with PCOS doesn't necessarily mean that you're barren, and
exactly.
you just need some help to
support.
A certain degree,
exactly.
And you'll be able to conceive.
But Buki, how successful would you say that the treatments have been in helping women with PCOS conceive?
Very successful. I think it's very dependent on the individual. And the severity of their PCOS, how many symptoms they're suffering from, where they are in their life stage in terms of reproduction, and also other factors. No one person is the same. So you might have someone younger who's just suffering from PCOS, whereas you have someone who's had kids previously, maybe suffered miscarriages previously. It's not just the woman that is, responsible for conceiving is also down to the man and his sperm, so quality of sperm. So there's multiple things at play. But if it's strictly just PCOS and you've balanced your hormones, then success rates are very high.
Okay. That's a very good one. And yes, I'm also like concerned about, people that think that you can't treat because of course this you mentioned it can be managed, but it cannot be cured. So like, what is your advice to these people that feel like if it's not cured completely, they would never be normal? Like people that feel sad or depressed about it, that they can never be normal. They're always going to be on some sort of medication or some sort of treatment to be able to get pregnant.
Yeah, I think that comes down to understanding and acceptance of your condition. It depends. I've seen women who have PCOS and come into clinic for treatment via medications, get pregnant, and then not require medications for their next pregnancy. I think, again, it's looking at yourself and looking at the situation as a whole. Can you do things to help or increase your chances of conception without medication? Whilst I mentioned obesity is a symptom of PCOS, can you manage the things that you are eating? Can you change your lifestyle and increase exercise? Can you do things in other areas that could potentially influence your fertility? Yes. But ultimately, I think it comes down to acceptance that this is the condition that you have. This is what I need to do in order to conceive. And it doesn't not make you normal. Like we said, 1 in 10 women have PCOS. So it's actually more common than you think. And actually conceiving is more naturally, without any intervention, is more a minority than it is the majority.
And Buki, at the beginning, you mentioned that there's actually no cause of PCOS, or the cause is unknown. Do you think there are like scientific researches that are ongoing just to be able to pinpoint what exactly? Because I think if we understand the cause, it helps with knowing what to do to prevent us from having this kind of condition. So it's just like a bit intriguing that there are no particular cause. It just happens that 1 in 10 women have PCOS.
No, and I completely agree with you. It would be nicer if we knew what was triggering the condition or the syndrome itself. But there isn't anything as such, and it's a hard one because fertility or women's health is a very sensitive area. So research isn't really as prominent as it should be in this area, just because not a lot of women want to come forward to discuss their symptoms or how they're feeling or their emotions, or to come through and have tests. So essentially, in order to find out what potentially may be causing it, it may potentially be invasive, multiple scans, multiple tests. And then when would you start? Because we know it can start as early as 12, 13, 14 years of age. Is it then you would start taking blood tests and monitoring teenagers to find out what's happening? Or is it more in the later stages that you would do that? So to find out the cause, you need to do research, and to do research in a condition such as polycystic syndrome or endometriosis or any other type of women's health syndrome is harder. So I agree with you in the sense that it's a difficult one because there's no known cause. Like I said, I touched briefly on the fact that it could potentially be genetic. So if you know that your mother or your grandmother on your maternal paternal side suffered with women's health conditions, then at the back of your mind, potentially you may suffer from those same conditions. But is there anything that you can do to get ahead of that? No, not really.
Okay, because I think you already touched on the question I wanted to ask, but maybe you could expatiate a bit more. So like for women who may not be ready now to start a family, is there anything they should know about managing PCOS to protect like future fertility?
Yeah. So I think the main thing then would just be at the best optimum health you can be, and that's from a holistic point of view, from an emotional perspective, from a physical perspective. So from a health perspective, you should be having periods every month. Unless you're on the contraceptive pill and you're intentionally stopping your periods, then you should be having periods every single month. So if you are not trying to have a baby, it's still worth investigating why you're not having periods every single month, so then you can try and get to the root cause of it. So if it is that it comes down to the fact that it's polycystic ovary syndrome, then the doctor may advise you that there's nothing that you need to do and to come back when you're ready to conceive. Fine, but then work on the other points of your health. So make sure you're eating the right things, make sure you're exercising, you're within your BMI, that you're preparing your body essentially for when that time comes.
Okay. Would you say, like, as a girl coming of age, like you just started seeing your menses, and what signs or like symptoms should girls coming of age look into to alert them to get diagnosed early? Early diagnosis can actually help. So,
With
yeah, what
understanding.
signs should they look out for that could be alarming for them?
So the first one is not having a regular cycle. So they've just started their cycle, and this is for anyone coming of age who's just started their period. Parents themselves should just get a calendar and just mark down when their period has started and expect to have that period again within 4 weeks. And it's just good menstrual health to know when your period is coming. There's apps that you can use to if you're more technically inclined, to go on your phone and just mark that your period has come at this time, and just to get to know your cycle length and how regular it is. That's the first one. So the first thing that something potentially may be wrong is if your period doesn't come, going on 2 months, 3 months now, no period. We know that periods can, every month to month, can vary in terms of the difference in length between them. And there's loads of other factors. Stress can cause that, emotions can cause that. That's fine. But prolonged irregular periods going on sort of 8 to 12 weeks of not seeing anything, then that would be something that you would discuss with your parents or make it known. It's harder for teenagers because they do need to talk to their parents about these things in order for them to then go to the doctors for it to be highlighted. Again, the doctor is unlikely to do anything just because they're so young. However, if then they're then experiencing other symptoms, so for example, weight fluctuation, and they're not really eating that much, that can be an indication that there's a hormonal imbalance. And then the facial hair or hair on the chest, again, hormonal imbalance, sign that you might have slightly higher levels of one hormone than the other. And there you can go to the doctor and you can be started on medications. I lean on the side of caution of starting medications quite early on in children or in women, teenagers specifically, just because you don't want to intervene too much with tablets and medications and things like that until it's actually really needed.
So I wanted to ask Buki, can a woman with regular periods have PCOS?
No. So a woman with regular periods can have a presentation, so they can have one of the features that diagnose PCOS, which is where they have loads of follicles on their ovaries. But to be diagnosed with PCOS, you need to not ovulate every month. And if you have a period every month, it means you're ovulating every month. It means that your body is going through the process of your hormones spiking, so that going up and then going down again in order to bring down a period. So to have a period, you must be ovulating every month. And a definition of PCOS is no ovulation.
Interesting. So like no periods or irregular periods is the key indication that you might have PCOS and you should get yourself checked.
Correct, yeah.
Yeah. So what is the differences between having like facial hair? Like you mentioned earlier that having facial hair can be linked to hormonal imbalance, like having more testosterone than your female hormones. Yeah. So does it mean that someone with facial hairs automatically has PCOS, or that is just hormonal imbalance and not PCOS?
That is just a hormonal imbalance.
Okay.
But can be more likely linked to PCOS if they then present with the two other diagnostic features, such as obesity and or irregular periods. That being said, some women some women have perfect BMI. Some women have perfect BMI. Some people have no facial hair but have an increase in testosterone, but have missed irregular periods. and have many follicles on their ovaries. So the presentation can differ slightly per person, but what triggers you to think I might potentially have PCOS is the irregular periods or the not ovulating every month.
Okay. Thank you very much for that answer.
Okay.
Yeah, so I wanted to bring us back to the fertility aspect of PCOS. So, like, in your experience, how often have you seen women with this condition going ahead to conceive? And after the first birth, do you think PCOS still interferes with fertility if you're trying to have another child?
That's a really good question. So I see it very often. I think that's because I work in the fertility space. So I do see a lot of women come into fertility clinics specifically because they've been diagnosed with PCOS and require further management in order to conceive. It's also something that your GP can help with as well, depending on the outcome of your investigations. And that's another really good question that requires more research, because what we find or what we've been seeing is that women come through having had treatment or fertility medications, get pregnant, and then for their subsequent babies no longer need any management, no medications. Not that their cycles then become regular, but they're less irregular. It means that there's more opportunities to conceive. And the reason for that is unclear. We don't know if coming through and having the initial treatment in the first place switch something on or switch something off or reset something hormonally. But we do see that some women get pregnant naturally from their second pregnancies, as opposed to with their first pregnancies where they required some assistance. We do also have some women who have PCOS just come back for their next child and do the exact same protocol and get pregnant. So again, very individual, but it is something that I've seen.
Okay. That's very good. And you've been mentioning fertility treatments, managing PCOS, and all. What are some of the methods that you use to treat this ailment?
Okay, so as previously mentioned, it's not normally treated unless you have severe symptoms, or you are trying to conceive. So specifically for conception, the doctor would look at everything as a whole, look at lifestyle and discuss with you about lifestyle, discuss medications. So there's medications that can help with the excessive hair growth. There are medications that can help balance your hormones. So encourage ovulation every month. There are surgeries that can be done. There's something, I don't know if you've heard of it or would have heard of it, called ovarian drilling. So I previously mentioned that with PCOS, you have circles, loads of little circles on your ovaries, which are follicles or cysts that have fluid inside, and
Yes.
it's difficult then for your ovary to know which follicle can grow and potentially ovulate. So there's a surgery called ovarian drilling where they literally go in and they drill the ovary to create space and allow ovaries to stop producing excess hormones. And then there's treatments such as IVF, where actually if you've got polycystic ovary syndrome, your success rates with IVF is quite high, because with polycystic ovary syndrome, you're not ovulating every month. Therefore, you're not losing an egg every month. Therefore, you've got loads of follicles, loads of eggs sitting on your ovaries. And therefore, if you were to have a procedure such as IVF, where they give you injections to stimulate follicles to grow bigger and go in and get the eggs, you should get a good amount of eggs and therefore get an embryo and therefore get pregnant. Through IVF, correct, yeah.
Thank you very much for that brilliant answer.
That's okay. But to be clear, you do not have to do IVF. You can have medications that can prompt ovulation every month. Some women who have PCOS tend to start with that. They get given tablets or medications that help a follicle to grow and help you to ovulate. And then we will tell you, okay, you've got a juicy follicle there. The lining of your womb is beautiful. Now is the time to take an injection to force ovulation. And then please go and have, it's called timed sexual intercourse, because we're telling you when to have the intercourse at home with your partner. And they tend to do up to about 6 rounds of that. So 6 cycles every month, or six cycles, or once every month, of something called ovulation induction. That's probably the first step if you have polycystic ovary syndrome, is let's get your body ovulating. Try and get pregnant whilst ovulating first. And then if that doesn't work, then you'd move on to IVF.
Interesting. Yeah, so Buki, just back to managing PCOS, you were mentioning earlier about lifestyle changes that could help manage the symptoms, such as the weight management and BMI management and all that. What else? What role do you think diet plays, and what advice would you give to women regarding managing PCOS with lifestyle changes?
Yeah, I think diet plays a huge part, because obviously with anything, if you have excess body mass, your body's working harder in however you look at it, whether it's from your heart pumping harder, your blood pressure increases, whether it's more tissue that your body has to produce insulin for, more hormones in order to regulate. So if you're within your ideal body mass index, so if you're within your ideal weight, it is better. Regardless, this is for anybody, even if you're not suffering from a condition. So having a healthy, balanced diet is is just very important in general. And then the recommendation is always to exercise, and we're meant to be exercising. I think it's 3 to 5 times a week, 30 minutes of cardiovascular exercise, just for general health. So I do think that diet plays a massive role, and staying away from processed foods, taking an all-round multivitamins, so nothing specific, but a multivitamin that supports your health in general and has everything inside, also very important. And if you feel that you're lacking in some way, so do you know what, listening to your body is very important, and I feel like not enough women do that. Note down your symptoms. You know what, today I actually was very tired, I had crampy pain, but nothing happened. You know, just keeping a mental note of how your body is feeling, so then you can go and discuss that with your GP, and they can do further blood tests to see if there's anything else going on, because everything feeds into the body.
Yeah. And Buki, from your explanation of, what do we call it, the management of PCOS, yeah? You know, for women that are trying to like conceive, obviously they won't go into like taking contraceptives, whatever, because first of all, ovulation is already a problem. It is irregular, so you can't keep track. So it's better you stay off contraceptives if you're trying to conceive. So for younger girls that are not like in the age of they are not ready to conceive yet, and maybe they're scared that, you know, they don't know when they're going to ovulate, so they have to like get on the pills, contraceptive pills, to keep themselves from not getting pregnant.
Yeah.
Would you say them taking the contraceptives would complicate issues more
No.
whenever they're ready? Would it make the PCOS more severe than it already is?
No, not at all. I think that's a common myth, in the sense that, you know, if I'm on contraceptive pills, I'll be infertile, or it'll be harder for me to get pregnant. It depends on the type of contraception you're on, and how it works in the body. How it's essentially, any type of contraception suppresses your natural hormones, in order for you not to get pregnant. And that's it. So really, once you take that contraception out, or once you stop taking that contraception, your body, it may take 1 to 3 months, but your body will go back to how it should go back to how it was prior to you taking contraception. The only thing is, you know, what we see happening is that a lot of women go on contraceptives at an early age to manage symptoms. So like, for example, endometriosis, you might go on contraceptive pills, or if, you know, very early on in age, if you know you're sexually active, you might go on contraceptive pills, and then you just stayed on it for a good 5, 6, 10 years. That's when you have the misconception that, oh, I was on contraceptive pills and now it's difficult for me to get pregnant. And that's not the case. It's that the contraceptive pills, because it was suppressing your hormones, it masked anything that was going on underneath. So it could be that you had polycystic ovary syndrome, or it could be that you've had something else that is stopping you from to get pregnant. But because you were on the contraceptive pill or contraception, it didn't manifest itself. You didn't see it, therefore it didn't need investigation, so you didn't know it. So common misconception is that contraception can lead to infertility or decreases your chance for getting pregnant, and that is incorrect.
Interesting.
Yeah, that's quite an interesting one. And you mentioned endometriosis, Buki. Would you like to just touch briefly on that? Because people usually confuse PCOS and the symptoms with endometriosis. So what are the key differences between these two?
They're wildly different. So, PCOS is to do with ovarian function. So the main thing there is your ovaries, whereas endometriosis is predominantly to do with the endometrium, and the endometrium is the lining of your womb. So that's the tissue that sheds every month when you have a period is your endometrium. Now, what happens with endometriosis is the cells that make up the lining of the womb also deposit themselves in other places within the body. So you can have endometriosis of the ovaries. You can have them on your bowel. You can have them on your diaphragm, in your cervix. So they can be anywhere really. And then what happens is every month when you should be having that period, those cells, they don't shed blood, but they also cause pain essentially wherever they are. And it's actually it's a really debilitating condition to have. So whilst about 70% of women feel pain during menstruation, that pain is likely due to an element of endometriosis. And they haven't had it diagnosed. And it is really hard to diagnose. So PCOS is probably easier to diagnose than endometriosis is, because the only way to really know you have endometriosis is to have a surgery where they put a small camera through your skin into your abdomen to look for those tiny deposits of the endometrium. So yeah, it's quite a debilitating condition.
Interesting. Thanks for that. I think
okay.
it's very key for us to understand what the differences is, because if people do not know, they sort of start to think of ways to manage this and by themselves without knowing the root cause of it. So thanks for touching on that. So now we're just going to be reading out some of the questions that we received from our amazing audiences. So usually we ask for followers to send us their questions anonymously so that we get them answered by experts like yourself, Buki. So we're going to be reading out the questions that we got from our audience on this particular episode on PCOS. And one of our audience is saying that from our own view, most of our mothers had PCOS and were undiagnosed. I have it now, and a lot of what I know about how to manage I learned from the internet. Same with fertility. What are some things that we can do now to help our daughters in the future? I think this is quite an interesting one. Yeah.
It is a good question, but I feel like I've touched on that a little bit earlier, is to listen to your body and keep a diary, make notes. So like the first thing I would do is to buy my child a calendar the day that they start their period, put that calendar up on the wall, note when your period has started. You have these apps, and on the apps they say, okay, day 1 is heavy flow, then day 2 is less flow, and day 1 I was feeling very strong cramps, but on day 2 I was fine. Note your mood as well. I think it's important, because it's not just PCOS and endometriosis, but also premenstrual disorder syndrome. So you have some girls who feel extremely low in mood during their periods, or just before their period is about to start, and they cannot pinpoint why, but that is almost like a high level depression that is highly related to the hormones that are happening in order for their period to come, but them not knowing it puts them in a bad headspace. Whereas if you could look at your calendar to be like, okay, do you know what, my period is due in 2 days, I know the reason I'm feeling like this, therefore I can ride through it, and I know that once my period comes, I'm going to feel a lot better. So for me, it's more having an understanding about menstrual health, but also documenting how you're feeling and teaching that to your children. So teaching them to keep a calendar, to note their symptoms, how they're feeling physically, but also how they're feeling emotionally. And then you then notice the differences. You then notice when you've got the missed period. You then notice, okay, a little hair coming out on the chin or the chest. Or you then notice when they're starting to eat more than they normally would, or they're inclined to have more sugary foods. So all the things that you're reading up on the internet, you've already noticed in their habits as they've documented it. And then also potentially at some point, if you feel like it's gotten to that point, then taking them to the doctor to be like, this is what my child is feeling. I'm doing A, B, C, D, E with them at the moment. Is there anything that I need to do to maintain their reproductive health? Which the doctor will likely say no.
I really like that. And you really touched it. It's about like tracking and keeping your records and getting the diagnosis earlier on, which will help you to manage it
Hope
going
this
forward. Yeah.
gets to our audience that sent the anonymous message to help them, in the future, just like they requested.
Yeah.
And also for our second question, someone said, what are some things people can start doing to optimize for when they're ready to start trying for a baby?
Oh, that is a good question. Again, similar to what I've answered, it's just keep an app. When you know your period is coming, also note some women have ovulation pain. So like, I personally don't, but some women know when they're ovulating. So not just from an app, but also notice signs of changes in your cervical mucus, changes in your body, knowing what your body is going through. Sensing that, you know what, actually, I'm a bit more, for lack of a better word, I don't want to use the word horny, but I'm a bit more horny now. Maybe I'm ovulating. And then you've noticed, okay, my breasts are slightly more tender. Maybe my period is coming. Or so those little symptoms like that. So even though you may not be ready to conceive, knowing what your body is doing, how your body is feeling, I think is very important. And that can help you in terms of getting ready for conception, because then you'll know the optimum time to conceive. So you'll know where your ovulation period is. Because it's not that you just have sex every single day from when your period stopped. That's not necessarily the case. Taking a preconception vitamin. So, like I mentioned previously, there's a lot of processes that happen within our body that feed into themselves. So, taking a preconception vitamin that has folic acid, that has things that can keep you of optimum health is important. And then that's it, really. Just living a healthy, balanced lifestyle, limiting alcohol consumption, limiting junk food, things like that. So that when you do get pregnant, because we know in pregnancy, most women put on weight. In pregnancy, their body is stretched. So being of the optimum health is important.
Oh, thank you very much for that answer. And
Yeah.
we've talked about like PCOS and fertility, right?
Mm-hmm.
Which is trying to get pregnant before they're
Mm-hmm.
trying to conceive.
Mm-hmm.
Now, after you've succeeded in like having a baby, what
Mm-hmm.
are like some of the effects of PCOS on after childbirth? Like maybe pregnant on breastfeeding, on postpartum. Is there any effect of PCOS on those?
No, not specifically PCOS. It will not affect breastfeeding. There's a hormone called prolactin that increases during pregnancy, and oxytocin and things like that are not related specifically to the testosterone and the estrogen that affects PCOS. So it will not affect breastfeeding. It may potentially affect when your period comes again postpartum, but a lot of other things also affect that. So for some women who are exclusively breastfeeding, they don't see their period for a long time. From those that are half breastfeeding, half giving formula, they might see their period sooner rather than later. So PCOS on its own will not necessarily have an impact post-pregnancy, because there's so many overriding hormones once the baby is born. However, once you're out of the postpartum phase, which there's an argument to be like, when would that be? So after about a year of having your child, then you might potentially see PCOS rear its head again, in the sense that your period doesn't come back, or it might come back but heavier than normal, or you might be displaying the classical symptoms that you had prior to pregnancy, or you might not get any of them again. It literally just depends per person.
Interesting.
And Buki, I mean, it's a known fact that women with PCOS usually struggle with managing their weight. I'm just curious to understand, what is the link between PCOS and weight, and would it always mean that women with PCOS would find it difficult to have a healthy sort of weight level and BMI?
No, that's a really good question. So there's a link between PCOS and insulin resistance. So the way that the body metabolizes insulin, meaning that the body retains more fat. Now, that being said, I have seen women who have PCOS who are very skinny. So, and I know that just goes against everything we just talked about. The classical presentation is obesity, but you can have PCOS and be within your BMI, if not less than your BMI, which is a strange one as well. So there is that link, and it's a hard one because I said, exercise and look at diet, but sometimes it's you do the exercise, you're eating salad every day and still you're not feeling a difference. There are some medications which we discuss with a healthcare professional about that can help with that balance, that imbalance with the hormones, and therefore help with the insulin resistance specifically. I touched on the fact that there is a link between having PCOS and being diagnosed with diabetes, which again is a condition that is linked with insulin. So yes, the obesity thing is hard. The weight management thing is hard, and likelihood is you would need medication in order to help you manage your weight if you have PCOS, because of the link between the insulin.
Okay. And okay, also, like at
Yeah.
the beginning, you mentioned that when we were talking about the cause of PCOS, you mentioned genetic disorder. So, are there anything that could be done, like during the process of maybe like IVF, to stop like a genetic sort of passing it on to
Yeah.
offspring? Is there any sort of medical intervention?
No, there isn't. There is a condition. There is a treatment called PGTM, which is where they biopsy the cells of an embryo once you've gone through the process of IVF, and in that biopsy you can look at chromosomes. But the genetic link that I'm talking about for PCOS can't be detected on a chromosome. So a chromosome is what makes up the DNA of a baby. But that's not something that can be detected on with this test that is done or has been created. So that genetic link is not properly clearly identified. So as one of your viewers, one of your listeners mentioned in their question that my mum had PCOS and her mum had PCOS. So that's where they're saying, okay, there's likely a genetic link then to PCOS, but how and why and where that is on a DNA access is not clear. You can't test for it. No, not like you can test for like sickle cell and other conditions like that. Yeah.
Yeah, good. Okay.
Yeah, Buki, so what are like some of the myths, surrounding PCOS that you feel like people often say that aren't true about PCOS?
Well, the main one is that I can't get pregnant, which I hope with this podcast we've dispelled that myth, because you most definitely can. That is probably the main one in terms of myths for PCOS that I can think of. We discussed and touched on the fact taking a contraceptive pill will affect my fertility, and that is neither true nor false. As I've mentioned already, that taking the contraceptive pill itself won't affect your fertility, but it may mask something that's already there. Potentially that your overall health does not impact fertility, but it does. Your overall health plays a massive factor in your fertility status. But that's it really. I can't think off the top of my head specific to PCOS, but just some fun facts about fertility in general is that certain positions do not mean that you will be more fertile or increase your chances of getting pregnant. I think that is one of the biggest myths that I heard. Having sex and then leaving your legs up does not mean that you're going to conceive. That's probably the biggest one. Position does not matter. There's so many millions of sperm within ejaculate, meaning that putting your legs up and some coming out is irrelevant. Another myth is that fertility issues cannot happen if you are young, which is false. They can happen if you are young. Young adults experience fertility issues as well, and I see that every day where I am in my clinic. A myth is that if you have irregular periods, you can't get pregnant, which you can once you've sorted out your hormonal imbalance. And that male fertility does not decline with age, and that male fertility does not affect or males do not significantly affect your ability to conceive. And that as well is false, that, it takes two. So whilst the massive focus is on PCOS and its conditions and its symptoms and managing hormonal imbalance, it's also important for your partner to be of the utmost health as well in order to conceive.
Yeah. Thank you very much, Buki, for mentioning, some of the myths that are, commonly understood and something like that. So
Yeah.
I hope this would help the audience to have more insight on PCOS and to not misunderstand a lot of things concerning.
Yeah.
Yeah.
This is like very, very important. But Buki, are there also like maybe like support groups or resources that women dealing with PCOS today should check out?
That's a really good question. Off the top of my head, I can't think of one specifically for PCOS. There are support groups such as the IVF Network, and even though it's titled IVF Network, they do also do other support groups for plenty of other conditions. There are miscarriage support groups out there, but specifically there is a PCOS awareness association, but I'm not sure if they have a group where you can talk anonymously on. It is something that I will look into, but it's good just to find a space, or even just talking to your partner, talking to other females. I think it's important to remember you're not alone, and the more you speak out, the more you realize that there are plenty of other women who are going through what you're going through, who have tried things that maybe you haven't, who can give a little bit of insight. But ultimately your healthcare professional is your first point of contact, so that you can get the most up-to-date information about treatment, about conception, and whilst having your condition. Please try and stay off Dr. Google. I think it's really easy to want to Google everything, but Dr. Google does not provide context, and a healthcare professional can provide context for you.
Thank you so much, Buki. It's been amazing having you on the podcast today on this episode, and
Absolutely.
really you've given us a whole lot of content, and we are happy that you've shared your ideas, experiences, and expertise with our listeners, and very, very helpful. I'm very sure that we are going to have more women speaking up about how they are feeling, and either to their partners or to like other people that they trust, because really we need to have more conversations around this. But we are very happy that you added your voice to the conversation, and we hope our listeners are able to pick one or two things from this episode. Thank you so much.
We appreciate you for coming on our podcast, and sharing this priceless knowledge with us. Information shared on this podcast are not to be considered medical advice. Always consult with a qualified medical professional for all your health concerns. Thank you.